On at Memorial Hospital. And Scott, how are you this morning?
I'm doing great. It's good to see the snow.
It's good to see the snow, definitely.
Finally. So.
Oh yeah, it's been kind of one of those long winters without it, but I mean the ski areas have been doing great. So
it's good to hear. So
yeah. So Scott, obviously the big thing, and it's in the news all the time, healthcare reform.
Yes.
And but I think a lot of people, it's a global thing, but a lot of people want to know, well, how does it affect me locally?
Yeah, and I think, regardless of the different legislation and the different acts that will be implemented over several years, healthcare reform really, you have to approach it from a local level, which is what we're doing. I mean, when you look at what are the key elements of healthcare reform, it's access to care, it's quality, and it's affordability. So, as part of our strategic planning process and how we, set our vision for the future, we're trying to create programs and services in the relationships that really will address those key issues. And
I mean, I guess what are some of the particulars that might happen here locally?
Well, I think when you look at the way that the traditional system has been structured, will be very different from where we go in the future. I mean, basically, healthcare has been a fee-for-service model, a volume-driven incentive. What you're going to really see is a change to more focus and incentives based on quality and results. And so we're restructuring our quality program so that we have the different measures and metrics in place so that we can ensure that we are providing the quality outcomes that our patients deserve. You'll see that paradigm shift throughout healthcare, and we've already begun that process here. Another key element, I think, too, is working collaboratively with our other healthcare providers in the community. And we formed a collaboration of the different delivers of healthcare, which includes the hospital and other key places such as the White Mountain Health Center, Saco River, Mineral Springs, Northern Health and Human Services. Really how we can coordinate care better as a group of providers as opposed to being kind of in isolated camps, if you would.
Yeah.
That's going to be really important in the future because really, if you look at some of the healthcare reform measures of the Affordable Care Act, you see pilot programs approaching around bundled payments, very different from what we see now. That really is where all providers will be paid, one fee for an episode of care, and how that is shared among the different providers will need to be addressed. So it's going to be very different. It's going to take a while for all these things to take root, but that's the direction healthcare delivery is moving.
Yeah, and one of the things too is the ACO.
Yes.
And so let's talk about that.
The Accountable Care Organization, it's a concept that's kind of the hot topic in healthcare now. There's not a standardized template, but really what the concept is alignment among the different providers from primary care, preventive care, the specialty care, the tertiary providers, how they coordinate the care episode, which is kind of what I was talking about with the collaborative. We're already taking a step towards, at a local level, kind of putting an ACO together, because ultimately, an ACO will be incentivized on quality outcomes. So how the insurance companies will work with this is, if you meet quality outcomes and if you reduce costs, there'll be a shared among the savings will be shared among those different providers.
Yeah.
So it really incentivizes the providers to work efficiently together and provide a quality outcome. I think you'll see more and more ACO models emerging over the next several years.
And is that something that's going to happen up here? Like the local person, how is that going to affect them?
Well, I think for the local person, it's going to improve access to care. I mean, one of the things with the Affordable Care Act is that insurance coverage will be extended to many individuals that don't have it today. Also, I think people will see better coordination, better service around this type of model, and ultimately better health outcomes, better preventive care, better follow-up care. So I think it's the right concept. It's really the work that needs to be done to really implement these type of models.
Yeah. Now, one of the other things, obviously going along with all of this, I mean, that's the specifics of healthcare, but you guys at Memorial Hospital have been doing specific things both physically and administratively and everything else. So, I mean, what's in the future for Memorial?
Well, I think, again, I mentioned how we've revamped our whole quality program, how we really deliver the service, make sure that we have the proper outcomes. Part of what we're doing also is looking at other programs and services that we could bring to the community to enhance access. For instance, we are getting ready to implement a new wound care program, which is it'll be a very sophisticated program using hyperbaric oxygen treatment, which is something you can't get anywhere in this region. We're looking at it, implementing a chronic pain management program. So, lower back pain is a huge issue, and it's done in different bits and pieces, but we're putting a comprehensive program together around that. We're evaluating, implementing a new sleep disorder program, folks that have issues with sleep apnea. Again, these are all services that people have to travel for great distances, and we're going to provide these things locally over the next couple of years as we put these different programs online. In addition to, the great services we provide now, and how we've, part of reform too is enhancing communication, electronic medical records. We have an electronic medical record in the hospital setting on the inpatient side, and now we've just begun the implementation for the outpatient, for the practice, an electronic medical record. So better coordination of communication also. Other great technology, people have heard about the new CT PET scan that we've just recently put online.
Yep.
So we're doing the right things too from a service standpoint to make sure people have access to the care they need.
Well, very cool.
So yeah, we're excited.
It's one of those things that's. We're very fortunate to have such a great hospital right in town, easy access, everything else, and obviously you guys are just looking to the future.
Absolutely, and again, we do provide a strong base of primary care, many subspecialty care programs. And we also have the right partnerships locally and regionally with our tertiary partners. So if there's a service that we don't provide in the Valley, a higher level, more specific, specialized service, we want to make sure we can still coordinate that care. So we really, what I've wanted to do since I've come here is have people look to the hospital for all the, for their health care needs, and we can help coordinate that, whether it's right here at Memorial or whether we need to help facilitate other care in a different setting. Yep.
And if anybody has any questions, they can always call the hospital.
Absolutely.
356-5461 is the number to call. And if you haven't been there in a while, it's probably something to go in and see the changes that have occurred. I'm always surprised to go in there. It's like, wow, there's new features, new amenities, new opportunities, I guess, for healthcare.
Yeah, it's and we have a beautiful facility. That's over the last several years we've really redone, refurbished all the patient care areas. So please stop by and take a look at the great stuff we have there. So
well, that's great. Well, Scott, thanks so much for joining us this morning.
My pleasure. Thanks for having me.
And I'm sure we'll be chatting with you again soon.
Absolutely.
So Scott Mckinnon from the Memorial Hospital right here in North Conway, and we'll be back in a minute here on White Mountains Today.